To all of you here today, welcome and thank you for joining us. It's not often that the United States Surgeon General, 2 United States senators, and the Undersecretary in the Department of Veteran Affairs are together in one place. But here we are in New Jersey to discuss an issue that affects us all and has become far too common in the lives of our families and our communities, which is opioid addiction. We know the toll the current opioid epidemic is taking on our communities. The numbers are staggering. Senator Booker and I hear this as we travel the state. It's part of our impetus of why we were pushing for the CARA legislation to become law. With nearly 2 million Americans suffering from an addiction to prescription opioid painkillers, this crisis is affecting every community and nearly every family. Over just the last 15 years, we've seen a parallel increase in the amount of opioids being prescribed and the number of people who suffer from opioid addiction. In 2012, there were enough opioid prescriptions issued, nearly 260 million, to give every man, woman, and child in the country their own bottle of pills. While many opioid prescriptions are issued to deal with legitimate pain, the impact of drugs leads to a dependency, often an addiction, and even more tragic, an overdose that results in the death of a loved one. And when people get this addiction, it's far cheaper to go purchase heroin on the streets of our cities than it is to try to find a painkiller to continue to deal with their addiction. Here in New Jersey, heroin deaths are up 160% since 2010, and we suffered more than 1,200 overdose-related deaths last year alone. In 2015, more than 28,000 New Jerseyans sought treatment for heroin or opioid abuse, significantly outpacing previous year's figures. 5 of New Jersey's counties, and I want you to listen to where the counties are, because sometimes we have a perception of what this problem is. 5 of New Jersey's counties, Camden, Ocean, Cape May, Union, and Middlesex, face heroin death rates that significantly exceed the number of treatment beds available per 100,000 people. Our state is facing one of the most challenging public health crises in recent memory. Now, I'm proud of Senator Booker and our effort because of the stories, the families, the challenges, the tragedies that we've heard that have moved us deeply. This is the second roundtable that we've held, of the efforts to pass the Comprehensive Addiction Recovery Act. But unfortunately, it's not funded, and there's still a lot more to do. So it is my hope that we can not only highlight this ever-growing crisis, but devise a path to end it. That's why I want to thank Dr. Murthy and Dr. Shulkin for being here today, including New Jersey in their Turn the Tide tour. This national campaign and the leadership and voice you both bring to it will strengthen our response efforts here in New Jersey. Because for me, this is more than about a policy issue. It is more than about another debate. It is at the very essence of saving lives. It is at the very essence of saving lives. I can't tell you how many families that I have dealt with who face this challenge, and how many times they've come to me and say, I can't get my son or daughter into a treatment program, or the fact that they never thought it would be their son or daughter or their relative who would actually face such an addiction. And how we deal with the question of addiction, not as a moral failure, but as a health challenge, is, I think, critical.
Congress recently passed the Comprehensive Addiction and Recovery Act, known as CARA. What do you see as the shortcomings of CARA, and what sort of changes need to be made to aid prevention?
Well, let me be direct, and that is funding. You know, when we talk about one of the most significant roles of the government, it's protecting its people. Now, we think about that in terms of our law enforcement or our national defense, and that certainly is an important part of it. But protecting our people is also from diseases and illnesses, from my perspective as a United States Senator. And while the CARA legislation, the Comprehensive Addiction Recovery Act, did a lot of good things, it expanded the use of naloxone, Narcan, that very often police officers and others use to save lives, and we have seen that it can save lives. Where it has also helped improve the Department of Veteran Affairs in terms of tracking of opioids by veterans. Something that I heard in one of my first roundtables by practitioners and others in the field who said that the whole issue of medically assisted treatment programs were limited in terms of the number of patients that a doctor could assist, and that was an artificial cap placed a long time ago before the present challenge. And as a member of the Senate Finance Committee, we had the Secretary of Health and Human Services before us, and I pressed her about lifting this cap, and of course, CARA even went further. So it's those were incredibly important things. But at the end of the day, the legislation provides not a penny towards any of the challenges we have. And so Senator Booker and I argued on behalf of the President's request for $1.1 billion because we have an emerging issue across the nation. And when you have an emergency, you respond to that emergency. Now, I can find many ways to pay for it. I can be very honest with you. So this isn't a question about spending money that can't be paid. I can take just some of the tax breaks that big oil gets that doesn't need it and make sure that Americans are better taken care of. So that's a false statement that we can't find a way to pay for this. And we couldn't get our colleagues who have an aversion, as we are seeing right now, on the challenge of Zika funding. I don't know how much more we need to understand of the emergent nature of the challenge of Zika funding. It's come home for me because my daughter is 5 months pregnant and she lives in Miami. And so I don't understand how the Congress can't come around to funding a national emergency. So we pushed for $1.1 billion, and then we negotiated down because we were told, well, that's not going to happen. So we said, okay, $900 million. And the House of Representatives, the Senate moved on it, but the House of Representatives said, no way, we're not going to fund any of this. So when we have an emergent crisis, whether it be Zika or in this case, the opioid challenge, we need to address that challenge as if we were addressing any national defense issue. It's a different element of how we take care of our people, but it is an important element. And so we're going to keep pushing as we return to Congress. I'm ready to go back now for an emergency session on Zika, or for that fact on this. But we're going to keep pushing because we can't say to everybody, change your whole prescriptive practices, challenge the pharmaceutical industry to maybe come up with a different set of painkillers that are an opioid base. We can't talk about rehabilitation and treatment centers if you cannot find one to get into. And so I think that its major failure, therefore, is a lack of any funding whatsoever.
Senator Menendez, why do you think conversations like the ones we're having today are so important?
I think that having this conversation to turn the issue of opioid abuse and addiction from one that people look in our communities to that person and say, you've basically have committed a moral failure, versus that you have an illness. And very, very similar to other challenges that we have had as a society. We're bringing mental health to the level that we now recognize and are trying to give people the wherewithal to deal with their mental health challenges. That when we recognize that this is not a problem of our cities, but that they can be in any suburban, affluent community in our state, that it faces no race, creed, income discrepancy. When we understand how broad it is and we have that conversation, and I've had mothers who have come to me begging me to help their son, but also begging me not to tell anybody about it. And of course, we always conduct all of our constituent efforts with privacy. But for them, the incredible pain that they have as it relates to their loved one who needs help is also matched with the great fear that someone will know that they have that problem because of the stigma that is associated with it. And I think it was one of the doctors here who suggested that very often when we have that level of stigma associated with an issue, people don't seek help. And when they don't seek help, the problem only grows worse at the end of the day. You know, I worked on something totally different than this, but it was also very interesting. It was postpartum depression. I worked with Mary Jo Cody, the former First Lady of the state, and Brooke Shield and others. And it was the baby blues. You had the baby blues. But nobody came to recognize that there is, for a universe of women, a challenge in postpartum depression. And so when we take away stigmas and recognize health issues for what they are, we advance the cause. And I hope that part of what we are doing here with the dialogue with clinicians and the press and public officials and law enforcement and others, all who are represented here, is that we can break down that stigma and meet the challenge of what it is, a public health challenge, a public health emergency. And collectively, I think we can do a great deal in that regard by just having these conversations.